So we will be moving on to a panel discussion, as I mentioned earlier, that will delve more deeply into the knowledge mobilization front, focusing on engaging the public through the media. And I'm pleased to introduce Linda Powell as the moderator of this session. So Linda's initial career started as a physiotherapist, graduating from McGill University. Her career path led to a 25-year involvement with the development of STARS Air Ambulance in Western Canada. She retired from her management role with STARS with the start of her caregiver journey for a family member who faced rapidly evolving end-stage liver disease. So Linda is a PFD partner, participant in the International Donation and Transplantation Legislative and Policy Forum, and is currently the chair of the Alberta Organization Group, which is a community collaborative to advocate for organ donation in Alberta. So over to you, Linda.
Thanks so much, Patricia. We're getting organized. Unfortunately, Mary was going to moderate this session and unable to do so. So I have some very big shoes to fill here and look forward to a very engaging panel here. As Patricia outlined, there've been, and in your programs, there's an outline of what has come before, learning from each other to set the baseline, engaging the public online during policy change, and how to collaborate together. And this particular session is going to focus on engaging the public through the media. And that's something that is so important to leverage and embrace and collaborate with. Sometimes we don't do it very well. And this is certainly an opportunity to learn from each other and decide what our next steps could be. We have a tremendous panel who are going to address the goals of the session, which is to clarify and get insight into each partner's role in your own organization and what resources you have to do that. Do you have any ideas on specific areas where we can work in a more collaborative way, and to identify next steps for 2023? So lots of work in 45 minutes, and certainly look forward to input on the chat line and questions at the end. So I'd like to introduce our panelists, and I believe the moderator notes are coming up for the introductions. Thank you. So fantastic. It's now my pleasure to welcome the panelists for this session. So Marat Slessarev is a clinician scientist and an adult intensivist based at Western University in London. He joined Western faculty in 2017 as an assistant professor in the Department of Medicine and does his clinical work at the London Health Sciences Centre. Dr. Slessarev is a co-lead of the CDTRP endorsed NUPART program and is a hospital donation physician and a regional medical lead with Trillium. Aviva Goldberg is a pediatric transplant nephrologist and ethicist in Winnipeg. She is the section head of pediatric nephrology and the associate dean of UGME Student Affairs and associate professor at the Max Rady College of Medicine at the University of Manitoba. She is also the secretary of the Canadian Society of Transplantation, CST, and a member of CDTRP Themes 1 and 5. Peggy John, who has joined us on the screen online, welcome Peggy, is the Associate Director, Organ and Tissue Donation and Transplantation at Canadian Blood Services. After 30 plus years of work in communications, Peggy is most proud of the last decade and the work she's done in leading support of organ and tissue donation and transplantation awareness. Peggy has been with CBS for over 6 years and is honored to lead a team whose work in education and awareness aims to inspire a culture among Canadians where organ donation is the norm. Christopher Calara is also online, is the Director of Hospital Programs, Performance and Evaluation for Ontario Health Trillium Gift of Life Network. He holds a master's degree in nursing and is an adjunct lecturer with the University of Toronto, Bloomberg Faculty of Nursing. He specializes in healthcare performance and system alignment, previously holding managerial positions in critical care, emergency departments, mental health, and respiratory services. So we have a 45-minute presentation around the 3 questions I outlined before. We'll be succinct in each area. We want to leave lots of time for questions and Q&A at the end. So again, the goals are to clarify and get insight into each partner's mission and the resources available, ideas on specific areas where it can work in a more collaborative way, and identifying next steps. So over to you, Marat.
Thank you for that introduction, Lynn. And so, I've been asked to give a 5-minute intro into this session, and I guess I'm developing a specialty in these 5-minute presentations of this meeting. They don't want me to speak any longer than that, so I won't keep you waiting for too long here. I do have a few disclosures. I do have research funding and donation, and then I do receive a stipend for my work as a regional medical lead for Trillium Gift to Life Network. So to start us off, I think this is what the media landscape in donation transplantation looks like. We can all agree that trust is the cornerstone of donation transplantation institution in Canada, and media plays an important role in communicating topics related to donation transplantation to the Canadian public. And we have all of these organizations in Canada that interact with media. So we have research organizations like CDTRP. We have professional societies, so Canadian Society of Transplantation and Canadian Critical Care Society on a donation side of things. We have Canadian Blood Services that informs policy related to organ donation in Canada. And of course, we have provincial ODOs that are responsible for day-to-day delivery of donation transplantation services. And I think that the challenge, that there are two challenges in this picture here. I think what is not clear is what is the role of each of those organizations in interacting with the media. And the flip side of that question is the media doesn't really know if they have a question, who should they go for to have this question answered? They have a question related to donation policy. Do they go to the ODO? Do they go to Canadian Blood Services? Can CDTRP answer that? And so these are some of the challenges that are central, I think, to today's discussion. So what has CDTRP done so far? We've held 2 media workshops this year. The first one was in April, and it was titled Learning from Each Other. We had experts attend both from conventional media, but also social media. And that was followed up in May with a second workshop titled Engaging the Public Online During the Policy Change. Really talking about some of the challenges of having these conversations, moderating conversations, and delivering clear and accurate and engaging content to the Canadian public. And I think those sessions were extremely informative. So I sort of decided to maybe expand on some of the questions that Linda mentioned at the beginning there. What questions really remain in this space? And I think it helps us to reflect on the purpose of the mission that we're trying to achieve here, and that is to build a strong culture of organ and tissue donation transplantation in Canada by delivering clear, accurate, and meaningful stories to Canadian public, right? And if that's our mission, then the 3 things we need to clarify for ourselves as people who work in this space, what is the role of different organ donation transplantation organizations in media interactions? How do we deliver clear and consistent messages on the topics related to donation and transplantation? And how do we shift, this is an important one, how do we shift from reactive to proactive messaging in the media? Because I think a lot of the times, and we are all familiar with this, we get an email saying, hey, we're doing a radio interview in about 2 hours. Who can respond on topic X? And you in wards, or I don't know, you can be anywhere, right? And you're like, oh, like that can do that because he's free, probably. And so it's a bit of a scramble, right? And it's challenging. So I think we really need to think about proactive, meaningful messaging that informs the Canadian public about topics that are critical to this community. So I'll stop there. We can leave the slide up or we can shut it down, whatever works, either way. Thank you.
Thanks, Marat. Thanks, Marat. Aviva, would you like to make your comments now?
Thank you. Mine are going to be relatively short. I did want to just echo what Marat said about how important it is, I think, for all the different partners to work together. So I'm here kind of wearing the hat of the Canadian Society of Transplant, which is one of the many partners that CDTRP works with. And I think one of the many people that are called or emailed or organizations that are called or emailed when one of these stories asks for a reactive response. And yesterday in one of the other sessions, I talked about my husband. One of the things I didn't tell you at that time is that he's a journalist. So I'm literally in bed with the media. And when we talk about and when we talk a lot about, ethics, like biomedical ethics, and he talks about journalism ethics, and we talk about the areas where there are similarities, the things that journalists, for example, have committed to not covering or to not having to being careful in their reporting of, and the many areas where they actually don't have a set of specific ethics about what they will and will not report on. And health-related stories often fall into that second category, that there is a need to get out the story, right? And he always talks about the idea that the dog bites man story never gets into the paper. It's the man bites dog, right? Journalists are looking for the unusual stories, the things that make a story special. But I think in donation and transplantation, we want to get across the everyday power of donation, that of course every donation and transplantation story is special, but that when we only report on the exceptional or the strange, that we actually miss a lot of the message. And the other thing I wanted to say that I learned from the media forum is that our timelines are so different from the journalists. Like, we want to be deliberative. We want to be careful in what we're saying. We want to think about what we're saying, and that's good. But that doesn't work on a 24-hour news cycle. And the journalists are often pitching stories at 6, 7 in the morning, have to have their copy in or their video in by 3, 4 in the afternoon, and they can't wait for us. So if we are not there for them, they will find another source. And I think we've all seen this when we've seen media reports that there isn't a CDTRP person or a CBS person or a CST person there. There's somebody else, somebody who is available and who is able to answer that call, sometimes with very good things to say and sometimes less so. And then the third thing I wanted to say is that if we do not get this right, the media often will get it wrong. So Marat and I were and we were all very upset with the Anne Heche story when Anne Heche tragically died and did become an organ donor. And the Washington Post said, their publisher said, or their obituaries editor, Adam Bernstein, said, "The newspaper doesn't recognize brain death, which is sometimes partial, as a clear marker of death. Quote, it's black and white. There's no gray area here. If you're on life support, you're still alive," Bernstein said. "Other publications can make their own judgment about when they're comfortable publishing. I'm comfortable when someone is actually dead." And we all know that this is factually incorrect, right? There are many, many clear statements and guidelines about when death can be declared, both legally and ethically, that do not fit with Mr. Bernstein's perception. He is the obituaries editor. He's not a scientist. He's not a physician. He's not a patient and family partner. And I think a lot of us were upset that the Washington Post took this position, but also how much damage that kind of a statement can do. So I think where our responsibility is to be available and to be able to step into that space so that the correct messaging is coming from the people who know these things, whether from a scientific or an experiential standpoint, and how we get there. I think it's difficult because we're all very, very busy people and we don't adhere to journalism's guidelines, but I think we have to do it. Yeah.
Thank you, Aviva. Thank you, Aviva. Certainly speaking to ongoing relationship and trusted source of information. Now I'd like to ask Peggy John to speak. Hello, Peggy. Thank you for joining us.
Hello, and my kudos to you, Linda, for grace under pressure, stepping in. Well done. Thank you for doing that. And it's lovely to see you there. And hello to my esteemed colleagues. Nice to see the faces behind the masks. Normally I'm in Vancouver, but right now I'm wrapping up a week of meetings in Ottawa. So I will be leaving this session to head right to the airport. So I'm in my hotel room taking the call here. Some great comments and some great opening thoughts. And so I wanted to pick up on a couple of things that were first said. So Marat, in your painting of the landscape, and I know Sandra, you in the comments, you added a comment about there are certainly additional key groups certainly that we work with from a media perspective, and those are the patient advocacy groups as well, the Kidney Foundation and Canadian Transplant Association, as well as the individual transplant programs across the country. And so certainly working with them in consistency of message is key. And Aviva, I'm pretty excited that I learned that about you. I had no idea you were literally in bed with the media, but certainly some great points. And just to build on what you said, and I think it's really important for us to understand is, we know that the elements of what makes a good media story are timing, as you've said. So is it now? Is it new? Is it the first? Those kinds of things. What is the human impact and the emotion? Is it unique? Is it popular? And I think the one thing that's always often there is there conflict? And I would say that, we've certainly witnessed in the past few years with COVID, we've seen, of course, the impact of COVID on the health system. But I don't know how well it's known that COVID's also had a very significant and somewhat negative impact on the number of people who are registering their intent to donate. There is a changing face of journalism as well. True journalists are becoming more and more rare, and there is a significant amount of misinformation and disinformation. And so what is happening is a decrease in the number of people who are registering their intent, but also for the first time that we've heard of, people asking to be removed from registry. And that's significant. And I would say, so what we've been thinking about as a national group, and certainly Canadian Blood Services has had a role in public education and awareness since we received the mandate for organs and tissues. And the focus of our work has been around collaboration and national collaboration, aiming for consistency of message, aiming for us all to be, saying the same thing. What we've really been doing is we have a national advisory committee, public education and awareness committee that includes a number of the leads from the provincial organ donation organizations whose responsibility is outreach or awareness. We also expand that group to include a community forum where we do bring in the voices of Kidney Foundation, CTA, and CDTRP, et cetera. And so the priorities that we've worked together on identifying is consistency of message, but also I think one thing that if we really do want to change culture, I think one of the key critical things we need to focus on is education. And that's a priority that we've been focused on and will be focusing on for the next number of years. So knowledge is key to building that new culture. So yes, how can we get educational tools and resources into the hands of the teachers, the students, and the parents who are educating the next generation? Because if you think about it, I'm old, and so I remember when seatbelts legislation was coming in, or even the stigma around things like smoking. How do you do that? You do that through education. And so collectively with the national group, we've created an education portal because, again, we recognize there are many voices in this country, and there will always and should always be many voices lending their voices and creating good resources. You never know where a good idea can come from. So after my session, I'll type the links to the site in the chat. But this portal is one of our tools where there are easy to use materials. They've been created, whether they're created in Manitoba or BC or the UK. working to create a national portal for those kinds of materials, but then working with our partners to how can we find champions to bring this to the schools and to the kids in the future. So that's my sort of where I'd like to think we can go. But if I bring it back to media, there will always be that aspect of conflict and diverse opinion. And so looking for and being able to, will never change their timing. They'll always have those kinds of things. So I think we have good relationships. And I think from our perspective, what we always look to do is to triage who's the best one to take this kind of call. If it's not national in scope, it's not appropriate for CBS, we'll funnel them to someone else to go to. If it's a specific area that is outside our scope, we'll always be looking to turn them to another source. So there will always be a shortage of funding. We all know that. And so if we can leverage and amplify instead of each feeling compelled to create, I think we'll be much better off and more successful in our path in what we're trying to achieve. Thanks.
Thank you, Peggy. Certainly the topic about resources and limited resources for everyone, collaboration is going to be so important as we move forward. Now I'd like to ask Chris to speak. Welcome online.
Good afternoon. I wish I was on the West Coast with everyone there. It looks like a really great time. But what we were thinking about is on the topic of resource and the health human resource challenge that everyone is experiencing provincially and nationally, it's important to be efficient and to create clear pathways for the media to understand where to direct these questions to and how to improve that end user experience. So Marat had this really excellent diagram that he was presenting with important sectors. And I think that's where the work really needs to start. How do we clarify role clarity? That's an important theme so that the media has a clear pathway of where all their questions can be directed to. For instance, ODOs were the stewards for the donation and transplantation for the province. Any questions related to system performance should go to the ODO, for example. Any questions related to policy or questions should go to CBS at the national level. So I think as a starting block, those need to be clearly defined for the media in order for those questions to be asked to the appropriate bodies. And then from there, once those relationships are established, then you could really start building these relationships with the media. But I think there really needs to be role clarity first as a foundational tool. Given the lack of resource that everyone is challenged with, we want to make things easier for the media. Because we have a lot of great stories to share too. We're looking to share those experiences. With the donor month coming in April, we often have the conversations closer to the month, but we should have those conversations much earlier in the process. Speaking to the theme of being proactive. So I think there's a lot of work there for the ground level first, and then we could look to expand and create further relationships with the media.
Thank you. So role clarity, key message.
Yes.
So let's move on to, you started touching on it, Chris, with some specific ideas about how we can work in a more collaborative way, and we can tie that into sort of next steps as well when we summarize later. But why don't we do a bit of a roundtable again, just 1 or 2 minutes each. Put you on the spot, Marat, Aviva, on specific areas about moving forward in a collaborative way.
Thanks, Lynn. I'm feeling my time is getting shorter and shorter this meeting, and I'm getting the message from going from 5 minutes to 2 minutes. Now, I think, this is an excellent point that, Chris highlights. I think clarity of messaging is important for sure, but I think if we want to help the media and if we want to help ourselves, I think it'll be important to develop some sort of a roadmap for both media and for ourselves, right? So as CDTRP, what kind of messaging do we want to engage in, right? Perhaps not commenting too much on national policy or performance of individual organizations and in various provinces. But we may be able to comment on, some of the research that we're doing, and some exciting research. And it actually may provide us with an opportunity to do some of that proactive messaging as opposed to reactive messaging, right? So I would, I think, urge the various stakeholders to come to the table. And, you mentioned, patient advocacy groups and someone else, transplant programs. They can also be included in this process, but I think it will be, you almost want a roadmap and hierarchy of where the media should go for other questions, right? And that will be a more efficient process than it currently is, because right now they reach out to us and we're like, no, I can't really tell you anything about BC because I'm in Ontario, and right, so we just keep punting them around. So I think it'll be a win-win both for the media and for ourselves.
Viva.
I would agree with that. I think a roadmap that can help the media, again, they're making time pressure decisions about where to go and who to ask, would be super helpful. And then I think also the recognition that we are going to say no to some media requests. I think specifically media requests that focus around a single case or a particular case. We need to be very, very careful about commenting in a public fora about something where we do not know all the details. So to have kind of an analogous situation, there have been outside of the transplant case space. There was a very famous case that happened in Manitoba years ago with a man called Mr. Goldberg, who was a man who was dying and whose family was seeking care, dialysis and other care that his medical team felt was inappropriate given how ill he was overall. And a lot of people commented in the media about that case, not being privy to all the details and all the situations that were going on. And so there was, after their inquiry and lots of things happened, one of the psychiatrists at our institution, actually, who was head of professionalism at the time, did interviews with staff who had been involved in the care of Mr. Goldberg. And what they found was that a lot of people felt like, because of privacy concerns and other things, that the only part of the story was being told in the media, right? It was being told by the people who were able to speak to the media without the privacy concerns, and that they felt like people were commenting without knowing all of the information. So I think that is something we need to be super mindful of, that when we get a call from the media saying, hey, so-and-so in this province is being denied a transplant or is being told that they can or can't do this, understanding that we are only hearing a very small part of the story, and that sometimes in respect for our colleagues, we may actually decline to participate. I think it's something that we need to also consider in this. Like, when do we say yes? How do we say yes? Who do we tell the media to go to get that interview? And when are the times where we actually have to say no because we can't possibly have all of the relevant information in the time needed to make a comment?
Thank you. Peggy, do you have additional comments to this?
Sorry, finding the mute button, trying to keep up with the chat, all that fun stuff. We can do all this, but honestly, as Aviva says, when the media have a deadline, they'll go to who they know, they'll go to relationships, and they'll try. But absolutely, there are many times when we say it's not appropriate for us to comment. It's not appropriate for us to step into that space. But we always try to provide an option for who is a more appropriate spokesperson. So I think that's always key. And then I did want to I see the chat, some of the conversation in the chat about patients and personal stories. Absolutely, it's the key aspect of what this is all about. So the power of personal stories. That's I think that impact is always and ever needs to be present in what we do out in that space.
Power of storytelling. Chris, additional comments?
So I'm big on efficiency. So I'm with Marat on creating that roadmap, clearly role definitions and defining what each of those sectors means to the media, so they exactly know who to reach out to. So it's efficient on both ends, and both sides are receiving the benefit one, the media is getting their questions answered, and two, we're sharing some of that information that the public needs to hear. So I do think clearly a defined roadmap is phase one. And then phase two is where we go after that. You know, how do we build dialogue and continue to build on those relationships? So that's where I see things going.
Great, thank you. I'm just going to intercede at the moment with just living stories always help bring things alive. And I'd like to give major kudos to the CDTRP on and the International Forum on what was done with preparing for the legislative change in Alberta. And, you know, we're trying to change culture, knowledge translation, and the potential for significant media attention. And being proactive, as you were saying, Marat, because there was the potential of having significant media attention because of the decisions being made in public forum. And the knowledge translation from the International Forum of succinct, reliable data from a trusted source was developed through the fact sheets that were developed about mandatory referral and data reporting. Came out in a very timely way. And as the legislation is going through with the potential of significant media attention, how were we going to get a succinct, accurate message out to the media from a trusted source? Because as you know, when things get into that sort of open political legislative forum, the messages can very easily transform. And we had that trusted source. So there's a living example of being prepared and having a proactive approach to potentially dealing with the media. We didn't have to, but that's a living example of it. And the information from that trusted source was read out in the legislature with media in attendance, right from the fact sheets. And RJ, who we saw in the first presentation, actually received those fact sheets and emailed them up to all the MLAs. So the collaborative, trusted pathway in building change and creating public education and awareness, because that's part of what that was very effective. If we hadn't had that, I'm not sure where we would have ended up. And it was very timely, but that's a living example of being prepared, having succinct messages, having a trusted source. So next steps, we talked a little bit about that. We have about 10 minutes left, and I'd like to see if there's any questions from the audience.
And roles, I think it's important because what I'm hearing is, well, if there's any national kind of thing or national impact, CBS should be the voice of that. I think we need to think that through a little bit more. CST is a national organization. CCCTG is a national professional society. The bone marrow people, have a national professional society, and CDTRP is a national organization. So I think it's a little more nuanced than just saying that everything national should be, or a question that has a national impact or a national question should be directed to CBS. I think those roles are not that clear, and we really need to think that through carefully.
Thanks, Lori. And role clarity has been a message through this whole theme. Trusted relationships at each level are so important. Go for it.
Mandy, will come up?
No. You did not. I was sitting. I was not fast enough. Good.
Okay, next question.
So, I mean, such a great discussion. Love seeing this as part of the series of what's been discussed already. May I suggest that as part of coordinating nationally, as was discussed earlier, you include communications in that and think about, I don't know, so I'm a patient partner. I'm also a communication strategist. I do media relations for a living. I get phone calls from media with organ donation questions. So consider having a calendar where you map out peak opportunity times of the year. As it happens, at our dinner table last night, there was this incredible story, and I just messaged Andre Picard. I was like, Andre, this is your holiday story. We thought about this is so cool. And so think about having those relationships and think about the time of year and having a calendar
in which like there are peak times to be doing these things, but leverage your success stories, because you can take a patient success story or a patient need or something that's not working out, but insert the research into that. Because sometimes they don't want to tell the research story, but they'll tell the patient story, and you can hook other things in there. Anyway.
Thank you. The power of storytelling. I see Sandra, your hand is up online. Let's take an online question.
Yeah, so Heather's brought up some good points, and there were quite a few patient partners on the panel when we talked about media. But someone who's been dealing with the media for 30 years, sharing my story, they always seem to have an agenda. And so, you know, it's the dynamics and like I'm trying to think of the dramatization of a story, and that is some of the things that that were brought up. But I really think that it's important that we have a page, I don't know if it's a framework, where the media knows who to contact, but I also think that we need to be, you know, we need to be, I'm trying to think my words here. We need to like set priorities so that we're reaching out to the media beforehand and that we're all on the same page, right? And it doesn't always have to just be like one rush thing during Organ Donor Awareness Month, right? And that we should be building those relationships with media people to let them know that it's important that the stories are being shared. And then also too, like when, you know, I go to share my story, I always want to make sure that I get the message in there about how to register and who to approach. But I also think too that providing those resources directly to all agencies that do the news, that would be a good idea.
Thanks, Sandra. Elaine.
Hi, everyone. So I'm like Heather. I come from this as a patient partner, but also as a former member of the media. So when you, I mean, these conversations always make me laugh, and it doesn't matter what the topic is, but it's like the media, the agenda. So I was a reporter for more than 20 years. That's actually how I met Lori and got involved with the CDTRP. And, you know, I made some notes as you guys were talking. And I think the one important thing you need to really distinguish is the difference between proactive and reactive stories. So the patient stories that you're talking about are proactive stories. Those are very different than some of the things you guys are talking about. It's like, well, there was a horrible MAID case that went wrong. We want somebody to talk about this. Very, very different dynamics, right? And so when you talk about this roadmap and you know, sharing it with journalists, I mean, I think in principle, that is a great idea. But I think what you're missing is whether or not the media will actually use it. And I can tell you that that will be a real challenge. Number one, you have regional diversity. So as a reporter in Vancouver, I'm calling UBC, I'm calling BC Transplant. I am not going to try and find, if someone from Western is available, that really doesn't help me, right? It's easier now with Zoom and a lot of interviews by Zoom, but still I want local representation because it's different in every province. So I think that's one challenge. The other challenge is that you have this tool. Well, the only way it works is if someone actually looks at it. And, you know, with the turnover these days in the newsrooms, you know, who are you going to send this to? Like who's going to look at it? And when they need to find somebody, are they going to remember, oh, somebody sent me that transplant thing like 6 months ago. Let me go look there. No, they're going to call who they know, which is UBC, BC Transplant, or whatever the equivalent is in where the area that they're from. Yeah. So I think that's one point. I see you guys have comments to that.
No, I just want to say, I think you're completely right. And I think one thing that we did learn too from the media workshop was that there are occasionally health reporters, like Andre Picard is probably one of the tiny few that truly are health reporters in the country, and that media has changed so that people are wearing so many different hats that they're not concentrated only on health. They have a million other things that they're supposed to do. And so they might not be able to access these resources because it's one of 16 million things on their plate.
Exactly. They might do one organ transplant story every 2 years. So to them, it's just like, where are my go-to sources and who have we interviewed in the past? So I think that's really, you know, everyone wants to build tools or build a website or put it on a web page. And that's always the first answer. But when it comes to communications, I mean, really, the first question should be like, is anyone going to use this? And how do we get the information to the people?
I'm just gonna, I think these are great points. The one comment I was gonna make, I think the clarity is not so much for the media,
It's for you guys.
it's for us,
Yes.
right? So if media reaches out to a provincial ODO or to patient advocacy group or you name it, CBS, and they're gonna look down and say, look, no, actually, this is who you should talk to about this specific topic. And that way, they're getting the latest information, right? So I'm not saying that this is going to be posted, we can pin it to their Twitter accounts, perhaps, or something like that. But I totally agree with you. But I think for us, we need to clarify who's going to deliver what message. And specifically, I think for CDTRP, what kind of messages do we want to deliver? What kind of stories do we want to, what are the 3 stories we want to tell in 2023?
For sure. And I think
Right.
that's a good point. If you're using it as an internal tool, then that makes a lot more sense. But I think too, also it's availability of spokespeople. So it's kind of useless if you have just designated certain people to talk about things, but when it's time, when your opportunity comes up, if those 2 or 3 people aren't available, well, then you've lost that opportunity. So, I mean, that's something you can't necessarily control in advance, right? Like you don't know on a certain day if someone on this list is actually going to be available. So, and then that's when the media will say, well, you know what, you're not available. I'm going to call the people I've worked with before. And if I can find somebody, anybody, a warm body, they want to fill their 15 seconds and they honestly don't really care who is talking and how directly related their expertise may be. And then I think the third point I wanted to make was just around the health authority and the ODOs and their own media policies. So of course, everyone is affiliated with an academic institution or with a health authority or a hospital system, and they all have their own media policies. So you may make this list and designate this person as an expert, but depending on what's happening in that jurisdiction, like for example, the BC Children's right now, well, currently I'm the comms manager at the BC Children's Research Institute. So right now we have a real problem with respiratory illness. So you should see all the media requests coming in. They come into the Research Institute because we have researchers who do that work. However, we are hamstrung by what we're allowed to have our researchers say because of the clinical implications currently. So then there are those regional dynamics that play into whether or not someone can actually speak, even if they are the expert.
Right.
Yeah.
Thanks.
Can I
Really
throw a
valuable
question back
comment.
at you actually before you leave the mic, and maybe one for Heather as well. One of the things we've talked about is whether media training for researchers, clinicians is useful. You're giving the thumbs up from Heather. Yeah, learning because we don't know. Yeah, how to do that. Okay.
Thank you. So we have just 1 or 2 minutes left. So Steven.
Yeah, a couple of comments about this. First, I think, again, it's one of the point is about the reactive and proactive communication. And the question is, why are we going to do that? Why do we want to do that? Because we want behavioral change in the society at large. Also, we want to be a bit broader as opposed to deceased donation. We also need to talk about transplant in general, deceased and living donation. And if we want to achieve behavioral change, knowledge is only one part, education is only one part. Motivation and emotions are a large part. And it's probably better to be proactive there. And it's also becoming a bit of a marketing as opposed to news and news coverage and reacting to events which are potentially controversial. We want to create our own narratives and be present regularly, consistently, and permanently. I think, and if that means that we need to buy time, I think that's probably one approach which may work. The other comment that I would, which comes to the trust issue, which is critical in this. And also we need to be kind of aware of, we talk about media here. Are we talking about mainstream media? Are we talking about what aspects and segments of social media? Who are the audiences? And how do we try to reach the audiences that don't trust us, don't trust healthcare, don't trust the mainstream media? And how do we build that trust? How do we try to reach out? And again, this becomes then an engagement and a very complex process.
Thank you. Really important points. Matt, final question. We're just over time, but
Gotcha.
get it in.
And I think so, the media training point, as someone who just went through the ringer with that report from Quebec, we had done some media training and it was a big deal. And I think, you're going to have media requests, even if we are being proactive and feeding stories, those are relatively easy. you know, in terms of like, you've arranged for something, you're giving them a story, the questions are going to be pretty softball-y, and what I've found in general. The reactive ones, that's where you need to have someone that's media trained, and having your system set up where, okay, we have this cadre of people who are trained and could respond to the more potentially contentious requests, versus having a lower level of training for people who are just going to respond during a feed stories to the media. I think having both available it would be a wise strategy.
Thank you. We could go on for another hour. I can see this is a really hot topic. There's many layers and complexities to this, but we've heard so many themes about how do we enhance the culture of donation. The distinction between marketing and news. How do we create behavioral change? Trust is a key piece. How do we reach areas? How do we connect with media in areas that aren't part of the mainstream media? How do we address misinformation? How do we incorporate storytelling? So it all speaks to this strategic roadmap that we've been talking about. And I think there's probably some volunteers in the audience who may be pulled into this bigger discussion. So thank you to all of our panelists online. Have a great day. Sorry you're not in Kelowna. Thank you for your participation, and let's continue this conversation in our break.